Hello. I'd like to welcome our first guest to the Great News Podcast, Miss Amanda, who is a mental health expert, which is an important topic, an essential topic for us to discuss for this podcast. So, thank you for taking the opportunity to do this interview. Our first question would be: can you share a little about your journey into becoming a mental health counselor?
Okay. So I'm actually a clinical social worker, and I didn't start out as a therapist. So a little bit about my career journey as a social worker. Uh, I started out wanting to work in social work because I love working with families and children. And one of the reasons why I like working with families and children is because families are the foundation of our lives, whether it has to do with a great childhood or a traumatic childhood. Family is the foundation. So, as an undergraduate, I got a degree in family studies and then pursued
Okay.
a master's in social work. After graduation, I started working in child welfare and CPS. I really did like working in CPS. It was a great experience and I liked it. I liked working there because I really enjoyed protecting children.
Okay.
And also, I enjoyed educating families on ways to manage their stressors with their children or other stressors in their lives. And we would direct them to resources to help their children. CPS is very family focused and it gets a bad rep because they think we just go around and remove kids. But really, we didn't do a whole lot of removals. A lot of it was focused on helping to strengthen the family and provide them with resources. Um, and then I transitioned into medical social work and I worked in a medical office in East Baltimore. And I also enjoyed working there. It was very different than CPS. I worked as a behavioral health integrationist and also as a mental health therapist. So I worked closely with the doctors and nurse practitioners there because a lot of times people may discuss their issues with their primary care provider. So I was there to help individuals when they talk to their primary care provider about mental health. I would go in the exam room and talk to them about their mental health and then connect them with mental health therapy. So I really also enjoyed that. I've always had a part time job as a therapist, and I didn't pursue it full time until 2018. And then I decided to do the mental health therapy full time. And I started a private practice in 2016. Uh, in and with our practice, I started out providing therapy to clients in their homes and a transition to virtual when COVID had happened.
Okay. So would it be accurate to say your inspiration came from helping young families, young kids? Is that correct to say?
Yes, yes, that's definitely accurate. Mhm.
Okay. So that brings to our next question. So in your experience, what are some of the most common misconceptions about mental health counseling?
I would say the biggest misconception about mental health counseling is that you have to be crazy to go to therapy or have some severe issue going on. And then also another misconception is that it has to be long and drawn out for years and years and years. Now, to be honest, when therapy started with segment Freud back in the beginning, that is kind of, it was long drawn out, talked about from birth. But it's evolved a lot over time. Um, so I would say actually with our practice, people don't have more severe issues and it's not long and drawn out. We actually, with our practice at Developing Wellness Solutions, we focus more on stress management and grief. Those are two of the biggest issues that we see. We also see clients for depression and anxiety. And the the majority of the population needs support with stress management and grief at some point in their life. So in our practice, we try to focus on helping clients develop skills and help them find ways to practice self-care in their life. And a lot of our clients are not seeing long-term. Most of them are seeing 3 to 8 sessions. But we do provide support for people that may need longer-term support.
That's a great answer. Um, I could see people thinking like, "Oh, you need mental health therapy. You must be crazy." But I feel like it's kind of changing. People are bringing awareness to that. So thanks for that response. So our next question would be, how would you describe your therapeutic approach, and why do you find it effective?
So these are great questions, Mr. Hines. So it's very important when you are a therapist that you use evidence-based treatment techniques, because then why are they coming to you? They could just call up their friend, right? Or their family members. So, and it's not that why I find it effective. They have studied these treatment approaches and they have found through research that they are effective. So they have been rigorously studied over time. So the two biggest ones that we use, and there is a boatload of different treatment techniques, and we stick to two. Cognitive behavioral therapy and solution focused therapy. They are my favorite, and those are the two that I focus on. Um, and these are especially effective with short term clientele. They can also be used in longer term clientele. So just to give you a brief description of cognitive behavioral therapy, which I love, it focuses on your thoughts and how your thoughts impact your emotions, which will then impact your behavior. So the therapists work with the clients to change their thoughts so that their emotions and behaviors change. Solution focused therapy, it works well with CBT a lot of the times, and it focuses on positive aspects in clients' lives, uh, focuses on their strengths in the client's life, and it helps direct them and support them in finding realistic solutions for their issues instead of focusing on the problem. So those are
Okay.
the two approaches that I love to use, and all of our clinicians at Developing Wellness Solutions use too.
Okay. Well, in my personal life, I kind of use that approach as well. Not to that level, but kind of the basis of what you were saying. Um, so I'm going to try this next question, right? So can you talk about a time when you faced a particular challenging case and how you handled it without providing too much details, of course, specific details?
Okay, so in CPS, it can be challenging. So I have been threatened numerous times. One particularly in mind, I was very, very threatened. And I've always handled whenever I was threatened in CPS, talking with my coworkers, supervisors, and we also work with detectives. So they also supported us. As an in-home therapist, we are also threatened. Um, and I would say that these situations that happened are a very small piece of my career. And I'm actually glad that they happened, because it helped strengthen me as a person and as a clinician on how to handle clients that are more ill, and then also just difficult people in general to work with. Both of the all the situations that have happened, I was able to de-escalate them.
So CPS stands for Child Protective Services. Is that correct?
Correct. Mhm.
Okay.
Thank you.
Um, no, at my job we have a lot of acronyms as well. So,
Mhm.
okay. Thank you. So our next question is, in your opinion, what are some of the biggest challenges facing mental health awareness today?
I would say the biggest challenge is getting more people into therapy. As I had stated earlier, you don't need to have some severe thing going on to seek out a counselor. Um, and one thing that I did fail to mention earlier, that one of the things I love about being a therapist, is I learn from my clients. So one thing that one of my clients had said, and she said this metaphor, she liked therapy because she's not a horse in the race. So you don't have to have a big issue. You could just want to talk to someone who's not a part of the issue, an outsider. So an outsider perspective is what's great about therapy. And sometimes, like I said, you don't want to talk to your friends and family about issues, or maybe if you don't really have the support, you can like friends and family to talk to. There are people that will talk to you about your issues, and there's a surprising amount of counselors with openings that will see you and want to talk to you about your issues. They signed up to talk to you about your issues. And one thing that's different from counselors than your friends and family is that we can't tell your things that are going on. Our license will get revoked if we say anything. And then you have the power to report us. They actually encourage it. In Louisiana, they have billboards up, call your counsel, call us if you have an issue with your counselor. I've seen that when I have visited New Orleans. And then also, biggest challenge is financial sometimes. So some people think they can't afford therapy or it's expensive. So I encourage you to call your employer in any state, and they, depending on your employer, whether you work for a small retail or big retail, or whether you work for the state, school, hospital, they offer employee assistance program, and you'll get free sessions. So that takes away the financial aspect. You'll get normally 3 to 8. Apple offers 15 sessions. So Comcast offers a whole lot. So you really just have to call your job and see, if they offer the free sessions. And then with insurance, if you have insurance, it's normally your uh, copay is the same as your primary care. So if it's $10 to go see your primary care, it's $10 to talk to a counselor. We're not considered specialists, and I don't think psychiatrists are either. It is primary care. It's not a specialty when it comes to insurance. And then if you have a deductible, or you have to pay a high amount, a lot of times the practices will set up payment plans with you. And then a lot of practices may have reasonable rates. I mean, you got those practices that want to charge 200 a session or something, but there are practices that are there that are more realistic with their fee if you don't have insurance.
Okay. So the main challenge is affordability, but there's resources out there that'll help you be able to afford seeking mental health. Right? Is that what you're saying?
Yeah, so I enlisted two.
Okay.
So I would say financial, people thinking it's too expensive, awareness that it doesn't have to be. And
Okay.
then I would say a biggest challenge is getting more people to get into therapy, and them realizing that it doesn't have to be the biggest, grandest issue ever. You could just be um, having a challenge at work that you wanted to process through with someone.
Okay. Thank you. Thank you. I think that's a great response. So this brings us to our next question. How can we as a society work towards reducing the stigma associated with seeking mental health treatment?
Talk about it, be open about it. Don't make it a big deal. If you're in therapy, maybe encouraging others to go. But with that being said, one thing that is great about therapy is because it is very private. So, but that has to be with balance. If someone's comfortable talking about their own journey, then yes, talk about it. But also, it's a benefit being private about it. But being open about it more. I guess there's a balance with that.
Okay. Thank you. So these next couple questions are going to be related to client relationships and outcomes. So the first question related to that is, what do you believe are the key components of a successful therapist client relationship?
And that's an interesting question, because a key component that I learned back even, in my graduate school days is you can't fake a connection. So the biggest thing is that if someone goes to therapy and after 2, 3 sessions, they don't feel connection or feel comfortable with their therapist, they need to go get a new one. Because evidence shows that one of the biggest predictors, it doesn't even, Yes, cognitive behavioral therapy, solution focused therapy, dialectical behavioral therapy, attachment. There's so many different treatments. Yeah, all those work, but nothing's gonna really work if you don't have a connection with your therapist. So I would say that that is the biggest thing. People have to make sure that the therapist is a fit, and if they're not, they can find another one. You're not obligated to stay with the therapist, and be upfront about it. And I'm gonna find someone that's a fit, and find someone that's a fit. And that's one of the reasons why I have a group practice, is because we switch clients around all the time.
Okay. So you're like the owner of your group practice?
Yes.
Okay. Okay. So that brings us to our next question. How do you measure progress in therapy? And can you share an example of a client's journey to improvement?
Okay. All right. So in smaller and shorter cases, small goals are created, and the client and therapist, they report to each other each session and check in about progress. For longer term cases, we use treatment plans, and the goals are listed and we measure them. Some we use measuring tools. And these can be used in longer term and shorter term. So the main ones that we use at our practice are the patient health questionnaire, the generalized anxiety disorder questionnaire, the bipolar spectrum diagnostic scale, and the mental health continuum scale. And we use this in the first session, every few sessions, in the termination session.
Okay. Thanks for that response. So these next two questions are going to be regarding specializations and evolving practices. So the first question is, are there any specific populations or mental health issues you specialize in? If so, what draws you to this area of focus?
So, like I was talking about earlier, about we focus on the CBT and the solution focused therapy. So we also have a specialty in the disorders the populations and the disorders that we see. Because I think it's important for people to focus on their niche and their specialty. So we at our practice, we don't see eating disorders, we don't see personality disorder. They're specialties. So our specializations are short-term counseling, employee and school assisting programming, and stress. And the issues that we treat are stress management, anger management, depression, anxiety, grief, and people that are struggling with life balance.
Okay. So, how do you stay current with new research and developments in the field of mental health?
So in our field, and this is similar to the medical field. So nurse practitioners, doctors have to do this, and I'm sure other professions, but those are the people that I've worked with side by side. To keep our license current, we have to complete continuing education units every 2 years. So I complete those. And then I also get a psychology magazine every month. So I keep updated with new information and resources with that. And then I also try to seek out new informations, articles, research. Um, and then I also network with other professionals in my field about different changes that are going on.
Okay. Um so thank you for that. I want to ask a couple more questions but on that topic, but I know we're short for time, so I'll keep to the script. So the next category is personal insights and advice. The first question would be, what is one piece of advice you would give to someone considering therapy for the first time?
To just do it. And if you don't like it, just find a counselor that's a fit for you. So one thing that's cool about therapy is it's 45 minutes all about you. And that person sitting in front of you signed up to learn all about you and your issues, and they're there to support you and help with your well-being. They're just 100% focused on you. So look at it that way. Um, and I would say that could help encourage you to just make that call. And then I don't know about other practices, but with my practice, you don't even have to really call us. Just text us and we'll get you scheduled. So that's just one less person you have to talk to.
Thank you. So, can you share a personal habit or practice that helps you maintain your own mental health and well being?
I would say for me, exercise. So I have not always prioritized that in my life, but I have lately. And what exercise does for me is it helps me to think and focus my mind and my body and be in my thoughts. And because of that, sometimes I don't even listen to music. I am that focused in my thoughts. And that's what I do for self care.
And for me, so I think that's very important, right? Because you're dealing with, 6, 7, 8 clients a day. Some might be have, trauma. Some might be, you know, have negative thoughts or energy. Some might have positive thoughts of energy. But a therapist has to be grounded enough and prepared to be able to assist with that, to overcome that. And I think that needs to be celebrated. I think that's really great because those are special bright lights. Those are special people that are able to do that. And I just think that that's wonderful. But also, I think it's an interesting question because what do you do with all that energy? What do you do with overcoming that? How do you recharge? And I do believe exercise is a wonderful thing. Is a wonderful thing to release and to charge up again. So thanks for that response. So the next category is looking ahead. What are the emerging trends or innovation in mental health counseling are you most excited about?
So for me, I love, love, love that everything is virtual now. So one of the reasons why I love that is virtual because someone could call and then like they're having a terrible day and then they could see a counselor by the end of the day. That you could do that with in person, but it's harder. And then the person, well, now I gotta drive and see this person, you know? So I do love that. And then depending on the benefit, if they really don't feel comfortable seeing someone, if their benefit allows, they may be able to do just a phone call. So I really do like the faster pace of the virtual because we have the ability to change the direction of someone's day on the spot. You know, someone calling a counselor versus having to drive across town to see them is really great. I really like that.
Um, could you describe how it was in the past more? Um, just to give the listeners an idea.
So in the past, with our practice, we were actually only based in Maryland and we did home visits, which was still convenient for the client. Um, but then, like, what if your house is, you feel like you got to clean up your house before the counselor come? I mean, we didn't care, but I mean, it's still more of a inconvenience,
Right.
have somebody come in your house. And then we also have we've seen people in person in our Perry Hall office. So that they would have to drive to the office and
Right.
wait in our waiting room. If the therapist was running a few minutes behind, if the therapist is running a few minutes behind right now, you could go do something else, and the therapist will text you when she's ready to connect.
Thank you. Thank you for that. So our next question is, where do you see the future of mental health counseling hitting in the next 5 or 10 years?
So this is a great question. So our operations manager Terry Anderson, he enlightened me about some things that may happen in the future. So I have not pursued this, but I did look into it. I actually met with someone about this. So they are pushing, I wouldn't say pushing, but some people want virtual reality therapy. So with the virtual reality therapy, and I actually met with one about this, is the therapist and the client will be in an environment, an office, or they could really be on the beach, and like they are like avatars,
Okay.
and they can interact with each other. And there's a couple drawbacks to this. The drawback is everybody needs a VR set. So even if all of our counselors get VR sets, that wouldn't be an issue. The issue is the clients. Some of the clients don't want to buy VR sets. And the clients change a lot. So, and we're virtual. So let's say I got 200 VR sets. I mean, what are we shipping them and then they have to send them back? That's if we could get past the VR set thing, or figure out another way to do the virtual reality. And then another thing with the virtual reality is HIPAA, Health Insurance Portability and Accountability Act. So we have to, as I was talking about earlier about our license getting revoked if we discuss your business, we have to do everything that we can to protect the privacy of clients so that no one can get into the virtual reality room. So right now in our practice, we use a HIPAA compliant video platform, a HIPAA compliant electronic health record. Everything has to be HIPAA compliant. And if it isn't, we could get into trouble.
Okay. So that's the Health Insurance Portability and Accountability Act, right?
Yeah.
Federal law.
Mhm.
Okay. Thank you. Um, so the next question is for the audience. So, what resources, books, podcasts, besides this podcast, would you recommend to our listeners who want to learn more about mental health
Okay. So,
and also websites?
all right. So for if someone wants to find a counselor, they could find a counselor through us. They also could go to psychologytoday.com if they feel like our counselors are not a fit. And then for reading, I encourage if someone's interested in CBT, there's tons of books that Judith Beck and Aaron Beck have wrote. They are actually the two people that I studied. And then for solution focus, there are other people, but Elliot Connie, I actually took a training with him. He's great. He has 4 books. He actually has one that came out this year that I need to read on solution focused therapy. So those are some of the things that I encourage and recommend that people read. And Psychology Today also has a magazine if someone, and the magazines are made for just a layperson. They don't have to be a mental health professional to read on.
Okay. Um, Thank you. Thank you. So this will be our last question of the day. I know I've asked you a lot of questions, so I appreciate you responding to them, and you did such a great job. Um, so the question would be, if our listeners would like to reach out to you or learn more about your work, where can they find you?
So they could go to our website, www.developing, spelled out, wellness.com. So again, www.developing-wellness.com. They could also email us at info@developing-wellness.com. And they could text or call us at 410-501-9591. We are in 9 states now, and we offer phone and video counseling.
Well, thank you for being our first interview on the Great News Podcast. You did such a wonderful and great job, and hopefully we can have you on the show again to talk about mental health also and how to be a successful business owner. And we greatly appreciate you taking the time out your busy schedule to meet with us today on this podcast.
Thank you. It was a pleasure meeting with you also.
Okay. One last question. Is there anything else that you would like to share before we leave? If not, it's okay, but I just wanted to throw that out there.
Well, for people just to not be intimidated about calling to talk to somebody.
Okay.
One thing I failed to mention too is, so I had said one of the reasons why people don't go to therapy is because they feel like the issue has to be severe or diagnosed.
Right.
So if those free sessions that I was talking about, you don't have to be diagnosed. Or if you do self-pay, you don't have to get diagnosed. Diagnoses are mostly for the insurance companies. So if if that's a drawback too, if you feel like I don't want a diagnosis, you could do that. But even if you call and you use your insurance, that if you feel like you don't have a severe issue, you're not going to get a severe diagnosis. I mean, almost everybody has suffered from anxiety at some point, or has some adjustment issue in their life. And so most people have had some type of diagnosis at some point in their life.
Yes. All right. Well, this concludes our interview. And thank you so much again for taking the time to meet with us today.
All right. Thank you.
All
Bye.
right. Bye.